Hi, this is Megan, and here with me I have Luke, Emily, and Jill. We're going to be presenting the first part of two-part presentation of suicide in older adults. Suicide in older adults is commonly an overlooked and ignored concept in Western cultures. We associate suicide with younger individuals, and we view it more as a tragedy because they are young. So while we're speaking to future health professionals, we just want to bring awareness to this concept and make sure people are aware that it is occurring in older adults, and it is something that needs to be looked out for. So beginning with learning objectives, upon completing the training, you should be able to identify individuals who are at risk for becoming suicidal, and then recognize the signs of suicide ideation. We're going to be going over some myths about suicide, and we're going to debunk those common conceptions. And then finally, we're going to understand and apply confrontational skills such as question, persuade, and refer, which is a preventative skill that we're going to be teaching.
Factors to consider when attempting to identify a suicidal individual include depression, prior attempts, loss of a loved one, physical pain, and social isolation. Adults that meet the criteria for these factors are much more likely to attempt suicide and should be monitored carefully. Financial uncertainty and loss of control over health conditions can lead to older adults feeling hopeless about the future. The American Association of Suicidology did a study in 2005 and found that there were 5,404 suicides among adults aged 65 and older. This averages out to nearly 15 suicides per day. Additionally, those who are more reserved tend to be at a greater risk. The group of individuals that is most susceptible to suicide among older adults are older men, specifically white males aged 85 and older. Older men are more likely to use deadly methods such as a self-inflicted gun wound or hanging, whereas women are more likely to use pills to attempt an overdose. Additionally, men are also less likely to seek treatment for their depression and thoughts of suicide. Older adults are more likely to die in their first attempts. However, they will often visit their physician in the month before a suicide attempt. Additionally, those who abuse alcohol and drugs should be monitored carefully, as this can result in an altered state and lead to a decision that is out of character. Older adults plan more carefully and use more deadly methods. However, it is less likely to be an impulse decision, as it is usually planned out for a long time. They are also less likely to be discovered and rescued, and the physical frailty of their bodies means that they are less likely to recover from an attempt.
It's important to look for signs of suicide in talk, behavior, and mood. The risk is even greater if the behavior is new or has increased and seems related to a painful event or stressor event. A stressor event is it can be many different things, including loss, unemployment, a family history of suicide, any types of family conflict, or legal problems. And there are quite a few different signs of suicide, and in the next two slides I have just listed a few, and those include being withdrawn or isolated, talk of wanting to die, acting anxious, talk about being a burden to others or not feeling important, and looking into ways of suicide. And so you might be able to see the searches that they've searched, and they may be looking online about different ways or looking into buying a gun, collecting pills, and they can be also behaving recklessly. This can include spending all the money, gambling, giving away things, just kind of out of the ordinary recklessness. Some more signs of suicide could possibly include them losing interest, talk about feeling hopeless, being preoccupied with death, talking a lot about it, searching it, seem to be giving a lot of their attention to that concept of death. They could be giving sentimental things away. They could also feel suddenly happier towards the end, and this is a little bit surprising to some people because it kind of can seem a little odd, but usually this comes about because they may feel happier that they've decided on what they want to do, and so they feel a little bit of relief that they have decided that that's what they want to do in the next few days or however amount of time they've decided on. So that's also a sign. So I also want to talk about some myths in the next few slides. Sometimes oftentimes, suicidal people somehow communicate their intent, say the few days or the prior week to their attempt, but the thing is, it can be kind of hard to pick up on that, the way that they have communicated it, so it's important for people not to feel bad that if they don't pick up on that communication. It just seems that's what research shows, that they oftentimes have communicated their intent right before. Asking directly if someone is suicidal, a family member or coworker, is extremely important. It lowers anxiety, and it's just super important to open up that communication. And sometimes that's all they need, is just someone to plainly and blatantly ask, are you suicidal? And if it's a no, then you just go on and say, I'm sorry, I was just worried about you, or however you want to word it, but it's not always just going to make them angry and increase the risk. It's going to lower the risk. Oftentimes, notes are not left after suicide. If they get the help they need after a suicide is attempted, they often, and they get the right help, they will not become suicidal again. So it's incredibly important that they get the right treatment, the right help. Only experts can prevent suicide is a myth. Anyone can help prevent a suicide, especially loved ones, and it really just usually takes someone to ask the question and care. Some more signs. That's the best treatment. There are some other treatments such as therapy, different types of therapy, medication, but oftentimes hospitalization is the type of treatment people go to for especially the more severe cases. Suicide prevention is everybody's business, and it's incredibly important for everyone to look out and pay attention of this.
So gatekeepers can include anyone. So there is an institute that provides suicide prevention training. It's called the Question, Persuade, and Refer Institute. And that is also what the method of their training is called. They offer individual, organization, and professional training to reduce the immediate risk of suicide. The Question, Persuade, and Refer method has become the most widely distributed gatekeeper training program in the world. Gatekeepers have been defined as those people who regularly come into contact with individuals or families in distress. So gatekeepers can include anyone who could possibly assist someone who is suicidal. So that could be family members, friends, teachers, members of the clergy, law enforcement, co-workers, correctional personnel, or primary and mental health care professionals. It is an hour-long training program, and it increases prevention-related knowledge. It aims to increase knowledge about the topic of suicide, get rid of those myths and misconceptions about it, and allow people to ask better questions to provide for people who may be suicidal and get them to open up and seek out help. Immediate effects of the training in a study showed increased self-efficacy and knowledge. As time went on, it went down some, but it still was increased from before they received the training. Findings suggest that this relatively short suicide prevention gatekeeper training can have an impact far into the future, making it a viable option for organizations with limited time and resources. Another study done found the same results. Participants showed significant large improvements in knowledge from pre to post training. There were even small gains maintained at a 3-month follow-up. Across 14 studies examining knowledge, effect size for the pre to post-training change was large. This indicates increases in knowledge immediately following suicide prevention training. Utilizing the benchmark method, this study demonstrated that the question, persuade, refer method is similar to other established gatekeeper programs, producing improved knowledge, sustained positive attitudes and social norms, and increased frequency of suicide prevention behaviors over a 3-month period. So as you can see, this is definitely a good program for people to use.
Alright, so just to go ahead, get some comprehension questions in there and give you a summary, we're just going to go over some common questions and kind of what you should have gotten from this, so going back to our learning objectives. So who is an at-risk individual and what would that person look like? So like Luke mentioned, an at-risk individual is going to be typically someone who has just recently experienced kind of a stressor event. They're going to be going through some financial hard times. They might be grieving a loss of some kind. Also, typically, white males over the age of 85 are at the highest risk. And also, there can be evidence of alcohol and substance abuse that makes that individual more at risk. So next, what are some signs that an individual might be at risk of committing suicide? Well, like Emily had mentioned, these individuals are going to be showing some signs that are a little more abnormal than what they're within their normal behavior. So they're going to be really preoccupied with death. They're going to take steps to go ahead and reach that suicide goal. So they might be searching online where to buy a gun. They might be saving pills. So you really need to pay attention to the talk, behavior, and mood of the individual that you're concerned about. Also, an individual who is happier, that's also a warning sign, just because they've made the decision and now they kind of feel this relief. So it's kind of an opposite behavior than what you would expect. So it's very important to keep that in mind. Third, what is a preventable measure that can be taken when dealing with a suicidal individual? Like Jill said, there's that great question, persuade and refer preventative skill that she talked about. So question would be, are you feeling suicidal? Are you feeling like hurting yourself? Persuading would be, talking to the individual, can we go and find a health professional that can help you? And then refer would be giving them those resources to actually speak to a mental health professional. We also talked about myths. So just to cover that real quickly, myths are, for example, one was that suicidal people keep their plans to themselves. And in fact, this is a myth. In fact, people communicate in their own way. It can sometimes be hard to pick up on, but it does happen. And then a second myth was that confrontation will make them angry. Usually it doesn't. It might make them uncomfortable a little bit, but it's better than not doing anything. Here are references that we used to gather information.